Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Langell. Earlier this week, Christina reported about urgency from Representative Venkat to make Congress make changes to the way that medical debt is handled for people, especially in light of the Trump administration's reversal of certain policies that were meant to make medical debt less of an impact on a person's credit report, their economic well-being. So tell us more about what this fight from Representative Venkat is all about.
Yes. So medical debt is a huge problem in Pennsylvania. We have, I think 13% of the population is significantly impacted by medical debt. And that's to the tune of billions. So it's a problem that affects Pennsylvanians, but it also affects people nationwide. Currently, Representative Venkat has a bill that has been passed through the House, and it's awaiting consideration in the Senate. And that bill essentially, it doesn't even do anything to erase medical debt or change the financial situation for people, so much as it requires hospitals to use a standardized language, and it requires hospitals to let people know that there are financial assistance options for them. Because a lot of the time when someone runs into medical debt, it's because they aren't aware that there are services there for them if they are under a certain income bracket or they're in a particular situation. So this bill just says, hey, you have to put it in plain language. You have to tell people. You also have to post it. You have to make it very clear so that people don't come into unnecessary debt. That's the least we can do, is basically what he's saying. That bill has been sitting in the Senate for a couple weeks. So I think Venkat's asking the Senate to make moves on it, to pass it so that the state has at least that protection. Meanwhile, there's stuff going on at the federal level that makes it very concerning for increased medical debt.
And Governor Josh Shapiro has been pretty vocal about the issue of medical debt and has wanted to forgive medical debt for, I want to say 400. I don't know. So I'm going to just start that part over. Governor Josh Shapiro has been very vocal about the issue of medical debt and making it easier for residents in Pennsylvania to either pay it back or to be in a position where it's no longer impacting them, because in his argument is that health it's often very beyond your control, and you shouldn't be weighed down in debt and have it impact your credit score, your life, because of a medical event that you didn't really have any control over. So what does he have to say about this action in Congress?
So as far as the state goes, I think Shapiro supports this bill. As far as Congress goes, I think there's a lot of tension there. So one thing about Shapiro's take on this is that you can buy medical debt for pennies on the dollar. So that's one solution that some people have put forward and that has been used to a small extent. But states can essentially invest and say, hey, we're going to buy this medical debt because it's very cheap, and then it relieves the debt from the people who are holding it. What Congress has done, or rather what a federal judge has done, sorry, this part's not Congress. What a federal judge has done has reversed a Biden era decision, which was he had this initiative that made it so that medical debt was not being reported on credit scores, so that you couldn't have, on top of all this debt that's already like really limiting your life, you're not losing opportunities. Our credit scores impact a lot. They impact jobs. They impact whether or not we can get a house. They impact whether or not we can rent an apartment. So these things, can be very limited. To have medical debt specifically be the thing that's keeping you from finding safe housing or something like that is just, something that the Biden administration said that's unacceptable. A federal judge just reversed that and said, okay, we're going to let medical debt ride on credit reports. That's an issue that's separate from what Venkat's doing, but obviously it integrates in with that. And then the other big concern is Congress because of their Budget Resolution Act, or the big beautiful bill. There is going to be significant changes in Pennsylvania to Medicaid. We're expecting, I think, up to about 300,000 people to lose coverage. And what Penny, the insurance marketplace, which handles like Pennsylvania's insurance, has said is that they're expecting premiums to go up by about 82% for most of the state, and then up to 4 times that in rural regions and for the elderly. So we can say with certainty that given the changes in caused by Congress passing this bill, that there will be a lot more people in medical debt, because when you don't have insurance, you end up with a lot more medical debt, and people aren't going to be able to afford to pay for insurance. And the other thing that Venkat brings up, he's a doctor, he's an emergency room doctor. He says that when people don't have insurance, they don't go to the doctor, diseases progress, they come in much later when things are much worse. Not only is that obviously a worse prognosis for their own health outcomes, but, a catastrophic trip to the emergency room costs a lot more than being able to go see your primary care provider for preventative care.
We'll certainly continue to track this issue. Follow us at thecentersquare.com/Pennsylvania.